right, y'all. So I am personally very, very excited for today's podcast guest. It's Dr. Kalli Hale, and she is an airway-focused dentist, a speaker, an educator who's on a mission to help people understand the powerful connection between breathing, sleep, oral health, and overall wellness. Through her work, she's helping uncover root causes, which we know I love, that are often overlooked, and teaching families how optimizing the airway can have a profound impact on lifelong health. I am very, very excited to dive into this conversation today. So thank you so much for your time and for being here.
Oh, Carly, thank you for having me. I've been looking forward to this for weeks. Your audience is just going to eat this up, I feel like. And I'm so excited to talk about all the connections to inflammation and systemic health and all of that when it comes to airway dentistry for kids and adults. So thanks for having me.
Amazing. Amazing. We
Yeah.
were we were chatting right before I hit record and I was like, wait, wait, wait. We need to get
Yeah.
recording here. Because personally, my children, I have three boys, 10 months, 4 years old, and 7 years old. And my
Oh,
4 and
beautiful.
7 year olds are working on their, expanding their palate right now using the Toothpillow,
Good.
which is something that we're going to get
Yes.
into. But you had just told me that you had done biological dentistry and worked with,
Hmm.
root canals. The
Absolutely.
root canal connection with my cancer diagnosis was a foundation of my healing. Tell me a
Yeah.
little bit about like just your background with biological
My
dentistry.
journey. Yeah, yes. So I feel like most dentists and physicians that enter into the holistic side of things do so when they don't have a choice. Something happens and you are forced to challenge the narrative. And now I challenge the narrative all the time. But when I graduated dental school, I come from a family of dentists. My parents are dentists. I'm married to a dentist. My sister's a dentist, and we live, eat, and breathe teeth and all of that. When I got out, I was a very traditionally practicing dentist. I was using fluoride and all the things. And long story short, I was exposed to some really important information surrounding mercury fillings, thanks to my very biologically dentistry practicing sister, and she was forcing this stuff down my throat. We went to the same dental school. She's brilliant. And she was like, "You got to learn about amalgam." And I'm like, "You're annoying me." Like, "No, I'm busy." Like, it's just sister to sister. Like, "What are you talking about? We went to a great dental school. Like, I'm sure it's safe." And I attribute so much of my journey to my sister and her ability to think outside the box, very similarly to my mom, and force me to look at it. Because once I realized that one very large piece of dentistry was potentially toxic and a lie, and made me think about everything else. And so I transformed my practice to this holistic practice. I became certified in safe amalgam removal, which was like the buzzword 10 years ago. It was like the organic label on fruit was like, if you were smart certified, that meant, the crunchy community was going to find you. And I was so just in love with the crunchy community. I went from patients who were coming to me for free cleanings to patients who were like seriously devoted to their health, which was my total desire. That is the best kind of patient to have. And let's work together. And I learned so much from my patients. I mean, truly, they would come in and teach me something, and then I'd have to go learn about it and decide my own opinion on it from my science brain and my regular brain. So it was a fun journey. And we screened for infected root canals. We still do in that practice. I own lots of practices now, and I head Toothpillow. So I'm very, very busy. But that part of my heart and journey in dentistry is still a huge part of me, because the amount of infections that we've caught, my dad and I and my husband, in patients who were told like, "Oh, it's fine, we just watch it," because that's what you're told about root canal cysts. You're told to watch them and they should get better. They should go down with time. Well, newsflash, they don't. And they're just there, and they don't cause you any pain because we took the nerve out of your tooth. So there's nothing to entice somebody to get it out. And if you don't really understand the way blood flows through the jaws into the rest of your body, that's a problem. But if you don't really understand that, then you're not ever going to link that to being harmful for something else. And the literature's changed a lot in the last 10 years. I'm telling you, like, we're finding root canal plaques in heart plaques, like the root canal bacteria in people's mouths, in plaques in their heart. Like, there's so much research happening now behind the scenes that I don't know how those things are going to continue to exist in dentistry, but for now that they do. So having a cone beam CT was critical in that journey for us, because we could really look at hidden infection in the jaws in a lot of ways. And then airway dentistry came to be for me. And I went from what I thought was my full passion, which was biologic dentistry, to airway being the thing that was going to make me unstoppable. And it's been just the biggest blessing in my life to become an airway dentist. And I practiced full time for many years. I mean, I was seeing hundreds and hundreds of patients every single week with Toothpillow appliances. It's way before the virtual company ever existed, and catching sleep apnea in adults and helping adults that were struggling with hypertension that they couldn't figure out why. And we find out they stop breathing 40 times an hour. And it's like, well, no wonder your body is just like literally on fire. Your inflammation is so high. And, as time went on and I realized my reach had to be further than me. The problem was so much bigger than me. And that is what spawned to.
Amazing, amazing. I'm a grateful
Thank
parent
you.
because I'm using this tool and it's helping us so much. And I do want to go to Airway because that's the intention of our podcast today. But before I
Right.
do, I just want to speak really quickly about the root canals because as I was briefly sharing,
Yes.
I was diagnosed with metastatic thyroid cancer in 2019. And instead of rushing into conventional, chemo radiation and surgery, it was, well, what is the root cause? Why did this happen? This is how I learned about biological dentistry in the first place. I went to an integrative
Right.
cancer clinic. He said, tell me your story. I told him my whole life story. And part of it was that I'd fallen in college. I knocked out my two front teeth and broke the upper bone in my mouth, which ended me up
Oh,
having two root canals and a titanium implant. That
wow.
was 10 years prior to the cancer diagnosis. And so he said, go see a biological dentist. And I go to the biological dentist. They do a 3D cone beam scan, and my mouth is black with infection. And he said, you're actually lucky that it was cancer. Like the bones of your face could have disintegrated with how
Oh
extensive
my
and
gosh.
terrible this
Oh,
infection
that
was.
gives me chills, Carly. Oh my
And
gosh.
I didn't have any pain. And so I had to get the root canals removed, the titanium implants, work on the cavitations from where my wisdom teeth had been
Yes.
removed. And I had to do all of
Right.
that to turn off the faucet of infection before I could
Right.
even do the root cause healing. And it's such a
Yes.
big part of my cancer healing journey because I always think, well, what if I hadn't asked the question and I just left that infection sitting in my mouth? And so as
Hmm.
you started as a you started as a conventional dentist, learned about biological dentistry. How many people, when you were doing cone beam scans, if they came in with root canals, do you have an idea of like a percentage of how many of those root canal teeth did show signs of infection?
Oh, I would tell you that I mean, it was all of them. I mean, honestly, there of course was a very small percentage that we deemed okay to monitor, but that's like 1%. It's really, because the fact of the matter is most people get a root canal because there's an infected tooth. And that infection is there prior to the root canal. So the problem is not necessarily like the root canal itself. It's the fact that we leave a dead tooth in the body, right? So it's not like what we put in the tooth that's like creating the jaw infection. It's that the jaw infection never went away because that never got taken care of. So you're just taking away your perception of the pain of the tooth, but everything that's bad about the tooth is still there. You can't sterilize a tooth either. And that's what people don't realize. Like you're in there cleaning out the bacteria with bleach and EDTA and all these things that nobody wants to know has been in their mouth and in their tooth, but it has been in there. But it still doesn't even sterilize it. So the bacteria is still there. So innately, it's just so a bad treatment across the board. And I would say most of them are affected.
Yeah, I'd heard that stat before. I remember even Dr. Tony at Hope for Cancer said that 100% of root canals are infected. And so
Totally.
I was curious from the dentist
I
side of the
agree.
mouth. Okay, good thing.
Yes. Yeah, I would
Okay,
agree.
well,
Yeah.
we get to have another podcast about that one.
Oh, I'd love it. Yes.
What what is the airway and why is it such a hot topic right now? Like we're all hearing airway health, airway dentistry, but I think a lot of people don't
Everywhere
understand.
now.
Like even me, I just
Yes.
started to learn about this. So lay it
Yeah.
out for me. Break it down.
Okay, so airway dentistry means that we are focusing on how you are breathing and how your jaws develop. If you're already an adult, that's the separate segment to today. But for kiddos, airway dentistry means that we're going to be looking at what the mouth is telling us that we weren't taught in dental school. Okay, it's like we were told in dental school tooth grinding in a child was normal and they'd grow out of it. Snoring was normal and they grew out of it. I've said this on many podcasts, but my biggest regret is telling a family that their kid's snoring was normal and they would grow out of it because that's what I was taught in my pediatric rotations. That's just what you're taught. So then you come out and you spit that out until you realize there's actually no supporting evidence for that whatsoever. It's wild that it gets taught. And I think it's because they just don't know how to fix it. They don't have any training, they being the professors in these dental schools. So it's easier to say, oh, they'll grow out of it because then they turn into a suffering child and a suffering adult. There's somebody else's problem. And it's just terrible. So airway is this, they call it your nasomaxillary complex. And You breathe in through your nose, it goes down into your lungs, and you need to be a nasal breather, obligate nasal breather. I tell everybody, if there's anything you get out of this podcast, is that your child should be an obligate nasal breather, no matter what. I don't care what stones you have to turn in order to get them to be a nasal breather, but that is the most important thing for them developing into teenage years and adulthood, period. And full stop. So when I'm looking at a child and I see tooth grinding or wear on their teeth, even if the parents aren't aware of it, I'm thinking, okay, are they tongue tied? How wide is their palate? So it means generally that I'm looking at things as this is the symptom, this is the sign of something else going on, and how can we intervene in a way that's non-invasive, incredibly safe and effective for these kids to help them, their brains develop better. Because when we're talking about underdeveloped jaws, yeah, that's something you can see. They have crowded, crooked teeth. Their tongue doesn't fit. Their mouth breathing. But I'm immediately thinking about the neurology. I follow a guy, a doctor, incredible. If you haven't looked him up, his name is Dr. David Gozal, Gozal for anybody listening. He's a pediatric neurologist. Everything he publishes, I'm reading right now, because everything is around what are the longer term effects of hypoxia, so low oxygen in our kids. What does that actually look like when it comes to memory, IQ, some stuff that he's worried is not reversible that is happening between the ages of 3 and 5. I mean, this is like really important, new cutting edge information coming out of somebody who should be highly respected in this field. So I'm looking at everything to make sure that, yes, I want straight, pretty teeth. I love to say the side effects of what we do are straight, pretty teeth, because what we're actually doing is making sure that your foundation, your upper and lower jaws are fully formed and something you can take into adulthood. How many people do you know that go into orthodontics as an adult? Why are we doing so much orthodontics on adults that have already had braces as kids? And it's because their phase one plan, AKA the tooth pillow or expanders, whatever, that phase one plan was not done right. And that's the narrative I hope to change.
Okay, so is that what, like, so why aren't traditional orthodontics handling this? Is it my understanding is that they're just moving the teeth. So break it down how this is different from what maybe a
Yes.
traditional orthodontist is doing.
Yes. So I would say over the last like 50 years, orthodontics has been done wrong on all of us. So definitely my generation. I have my own crazy ortho story of what I had to undo on myself after having braces multiple times. And I interviewed one of the best airway orthodontists out of Florida, a good friend of mine. His name is Dr. Mike DeLuke. I interviewed him on my Instagram about a year ago because I heard his story, but I needed to understand why the orthodontists were so completely uneducated in sleep and airway dentistry, or really just the pediatric growth and development. Don't even talk about airway, just like how you guys are like the guys to be doing this. Like, why are so many general dentists becoming these epic airway doctors and the orthodontic community itself is behind? And he laid it out to me really well. He said, listen, we're not taught to treat under 7. So you send us a 3 or 4-year-old, we don't have a clue what to do. It wasn't covered in our residency. And so we don't treat it. We say to wait because we don't know how to handle it. They're not taught these myofunctional habit corrector appliances. They used to a long time ago, or the orthodontists actually invented myofunctional therapy. And I forget if it was in the 50s or 60s, myofunctional therapy got taken out of the curriculum. And it was just like this wave of generations of orthos that never learned myofunctional therapy. They never learned the muscle component. And now it's like coming back in droves. But how many kids have been treated? How many generations of us have gone through this? And now we have this epidemic of sleep disordered breathing and obstructive sleep apnea. So it's partly politics, I will tell you, because that's in every facet of medicine and dentistry. But it is also just a complete lack of understanding of how to treat that age. So the other thing is they do upper expanders only. So just to get really granular right now with like how we do it at the Airway Dentists and when we're sending a patient from Toothpillow into an office because they need expanders, I'm so picky. I had vetted these doctors. They better do it exactly the way that I do it. Because my name and reputation is on the line if these kids are given the wrong expander treatment and their symptoms don't get better, which we see all the time. All the time. The number of second opinions that come through the Toothpillow portal or walk into my office of like, oh, we had an upper expander, but she's still bedwetting, or she still has ADHD, or she's still snoring. And here's why. There is an ideal width between your first molars, okay? And we know at age 4 and 8 and 12 and 16 what that width should be It's just science. We know what it should be to fit all your teeth. All of our kids are underdeveloped at this point. We're so many generations screwed up with our diet, soft foods, all of it. It's like most kids need intervention now because of how many generations we've gone by. But if you only do an upper expander, because that's the only thing you were taught in residency, you can never take the upper as wide as it actually needs to be if you don't know how to do the bottom. So what you do is you put an upper in and you do a little bit. You do like 3 or 4 millimeters because that's, unless there's a crossbite where the upper is like on the inside of the lower, obviously you would do more. But most children that are underdeveloped don't necessarily have a crossbite. They're just narrow in all forms. Everything needs to be wider. And you cannot get to that minimum width if you don't know how to do the lower arch. And I have done cases that you wouldn't even believe, like cases where 3 or 4 other orthodontists said the only option was to permanently remove a tooth in order to make room. And that's not, I was so glad they ended up in my chair. And I knew in that moment talking to that mom that her trusting me to do this and her saying yes for me to fix it was going to be the difference in the way this child aged. And so to me, the burden was immense on not treatment planning it out of fear, like, oh, your kid's gonna have a heart attack, nothing like that. It was just, I promise you I can make room for all of their teeth and you really should let me try. Because if you end up having to pull one, which I knew they wouldn't have to when I was done, fine. But at least you've exhausted all resources at that point. You've tried everything that you could try. So when you don't know how to do a lower arch, and all you know how to do is put brackets on it and line the teeth up in an insufficient foundation, you're not going to make this wide enough. And the roof of your mouth is the floor of your nose. And you want to have really narrow nasal passages, or do you want to have really nice and wide nasal passages? And the answer is obvious. We want wide nasal passages so that the resistance when you breathe in is very low. And that resistance is very high in most kiddos we treat because their palates are so narrow. And the biggest symptom of that is crowded teeth and mouth breathing.
I'm taking so many deep breaths through my nose while you're talking. I'm like, okay, get in that air, baby.
I know. It is so good.
You mentioned bedwetting and you mentioned ADHD. So what are some of the health and behavioral problems that mouth breathing can create for a child? So
Yeah. I want everybody to think if your child has sleep disorder breathing, the amount of inflammation and adrenaline and fight or flight mode that's happening to them at night is wrecking their organs right now. Okay. And in ways that get worse as you get older. It turns into hypertension and hypothyroid and, adrenal fatigue and just all the things that we deal with, especially us women, I will say for sure, as we get older. But when you have impaired sleep phases. So if you think, I always relate it to maternity leave when I had a baby. Oh my gosh, you're up all night. Now you love that baby more than anything else, but I was very grumpy. I was not the nicest person to be around when I was going on intermittent sleep. The children that are waking up constantly from their sleep disorder breathing, what the parents know about it or not so relevant. It's happening. We've done sleep studies. We know they're waking up. They don't necessarily get out of bed, but their sleep cycle is jacked and their deep sleep isn't high enough and their REM is not high enough. And your REM is so critical for memory building and working through problems and just memory in general. So when that's happening, the kids are not good learners and their brain health is not where it should be. So that's what's affecting this ODD, ADD, ADHD discussion. The oppositional defiant disorder, I'm not sure if you're familiar with that or looked into it much, but it's the saddest cohort of children that I treat. And it is also the most rewarding because these parents will come in and the kids have been struggling. Like they are on medications that were never intended to be for a child under 18 years old. And I never shame a parent that has put their kids on meds at that point because so much hurt has happened. That family is on fire. And they'll say, I love my child, but I don't like my child that much. So we don't have a good relationship. Everything is a fight. And these kids will come in, they will not make eye contact with me. They will not talk to me. They will not answer a question. I look at them and I'm like, you're just so tired and you're so sad. This is just how your body is expressing it. And then I have a separate conversation with the mom, which ends up with her normally in tears because she's so stressed out about it. And I have to encourage, you've got to let me do what I already see is wrong. I mean, I can identify the teeth on a child with ODD right away. Their lower jaw's so far back, their front teeth stick out like this. I know they're choking on their tongue all night. It's obvious to me because I've treated so many of them. And we get those kids back. You get them. And that's what I tell them. Just trust me. Let's do our sleep study. Let's get them in a Toothpillow. I'm going to start whatever treatment has to be started based on their age. and you're going to watch this change. And it does every time. And it is the most rewarding thing. So the earlier you start, the better. It always breaks my heart when these kids that finally do get diagnosed with something like ODD and they're 9 or 10 end up in my chair because I should have treated them at 3, you know? A lot wouldn't have happened at that point, but it's okay. They found me when they did, and here we are. But the more we can talk about it, I think ODD is one of the most hard, this is one of the hardest ones for moms to share, even with other moms, that they got this diagnosis. Because think about the title of it, oppositionally defiant. Like they're just mean. You know, like what does that mean? Like I'm like, what a title for a diagnosis that is reversible, you know, with proper sleep and proper oxygen.
But it's interesting because with that or with ADHD, you would, most people, myself included, wouldn't necessarily go dental health to begin.
Right. That's what we have to change. With your help on this platform, 100%. Same with bedwetting. Who thinks to go to the dentist when their 10-year-old boy is wetting the bed at night? Nobody's thinking that. And it's not you go to your general dentist, you see an airway dentist. But people aren't relating sleep disorder breathing and obstructive sleep apnea to ADHD, ODD, bedwetting like they should be. It should be the first thing that is ruled out. I tell dentists this all the time when it comes to kids' tooth grinding. I'm like, if you see a pediatric child that's grinding their teeth, it is sleep apnea every time until you can prove it's not, because they can't. And then the kid gets treated. So that's the way I verbalize it as I teach dentists, because I'm like, stop thinking this is going to go away. What a cop out. You know, easy for you. You're going to tell that mom that, and on she goes, and you go drink your coffee in the back office. Like, absolutely not. This is like a life that needs to be saved right then and there. So anyways,
Incredible.
I could go on and on about this.
Yeah, no, it's fascinating. But so what I heard you say is that most all children have this narrow palate. And when we heard
Yeah.
like on the extreme one side of a diagnosis, but then we have on the other side, let's talk about my kids, for example. They're 4 and 7 years old, and there were no major symptoms outside of me waking up in the night to watch them sleeping with their mouth open. So for the
Wow.
parents listening, and I'm like, okay, I have my own dental journey. I'm always focused on prevention. I'm like,
For
what do we
sure.
need to do? I asked a girlfriend I ran into her at my juice cafe, and she's like, I need to tell you about Toothpillow. I'm like, this is literally an answered prayer
Oh,
for me.
wow. Oh
Yeah,
my
that's
gosh.
how it happened. I was like,
Wow.
what do you, my kids are mouth breathing. I've heard this connection, and we
Oh
got
my
into an hour-long
goodness.
conversation. But for the parents listening, what should they be aware of that they might be thinking, okay, this is something that I need to do for my children? Is it simply mouth breathing to bedwetting to a diagnosis? Like what are the symptoms
How
that
do we
they are
know?
aware of?
Yeah.
Yeah.
So the best way that I can explain it, that I think is most helpful, is that sleep disordered breathing as a title is a spectrum. Okay. On the very front end of that is mouth breathing. Okay. So a little bit, and your mouth doesn't have to be wide open. I had to tell mom this yesterday. I'm like, there could be slightly parted lips at night that you're not paying attention to. And most of the apneas and the mouth, the really severe breathing disorders that happen are between the hours of like 2 a.m. and when they wake up, which you're usually asleep. Okay. So we check on them maybe at 10 or 11 before we go to bed or whatever. That's not even the worst part of the night that's happening yet, which I think is important to identify, because just because you check in on at 11 and they're doing okay does not mean that's how the hours of 1 to 7 or 8 a.m. is going to be, because that is when REM sleep happens in the second half of the night, and their entire skeletal muscle structure is different during that period of time. A little granular there, sorry, but I think it's important to pay attention to. So for people that come in to do an assessment with Toothpillow, we have a lot of questions on that, as you experience with your children's intake form. And we put that pediatric sleep questionnaire in there because some parents will identify with something that they wouldn't really think was related to that. So even if you don't recognize mouth breathing, we're going to be looking at those intake photos that you take of your child and the questionnaire to determine and help you to know if there's a problem or not. Because you really need an expert's opinion on that, which is why we built Toothpillow. I needed an airway dentist in every single state that was amazing, that would take on these kids that didn't have access to the care or whatever, and look through it and help them to identify something that they might be missing. So for anybody that's like, I don't think my kid has any symptoms, don't risk it. Don't make that decision on yourself. The assessment is free for now. Like, it's wild to me. Like, you could still just put everything in and get a report from a doctor at Toothpillow, and you haven't paid a dime for that. So it doesn't make any sense to not submit, because we will be able to catch and see things that maybe you guys haven't. The other would be no symptoms at all, not even mouth breathing, according to the parent or anything, but there is no space between the baby teeth. That alone is, you need a Toothpillow. because the adult teeth are 2 to 3 times the size of the baby teeth. So if they're perfectly straight and they look great and they're touching, you're already moderate crowding as far as dentistry is concerned. So you could just take that as a reason to be concerned and want to get into a tooth pillow. And the whole thing is, the earlier you start with the least amount of symptoms, the healthier your child is and the easier everything will be. So I wouldn't wait until a dentist, when they're 8 or 9, says, there's some grinding signs over here, because at that point it's probably been happening from since they were 5 and you just didn't know.
I heard that there was supposed to be a nickel size in between each baby tooth. I'm like, I'm sorry, this is news to me. That's wild.
It is. It's wild. Yeah. Nobody, you just don't see it anymore.
So my 4-year-old is extremely compliant with his tooth pillow. I put it in
Oh,
every night, piece of cake. My 7.5-year-old has we're on our first month and we're just working on getting him to fall asleep with it in. And I think it's just like
Yes,
it is, I guess that's just a testament to me sharing it's much easier with my younger one.
absolutely.
I think it's not
Yes.
as uncomfortable for him, maybe. His mouth is smaller. I
Right.
don't know exactly, but he's
Yes.
very compliant. He loves the tooth pillow.
I love it. And that's a big question we get a lot, is how am I going to get a 3-year-old to wear it? I'm like, that's honestly the easiest one. They're our easiest ones. The ones that are between 7 and 10, we get a mix of sensory stuff, because by then, if they need a tooth pillow and potentially expanders in the future, then there's already been a lot of muscle dysfunction that's been happening since they were 3. So I immediately go to, they put it in, it feels weird, it's holding their jaw in a certain way. There's stuff that can make them gag. Like it takes time, and that's okay. I'm like, at 7.5 or whatever, you have plenty of time. Like, we're going to get it right regardless. So I always try to calm the moms down in a way of just like, don't make it stressful, because the kids can sense our stress. Like, you're working on it, and it's easier for some than it is for others. And it's same with adult patients. Us adult patients are no different. Like, some of them go into a snore appliance and they're doing great. They don't complain about a thing. And others are like, man, this is just really a lot, And so our little babies are no different. And we have to guide them, a little differently as well.
So we talked about what, some of the things to be aware of for parents, like what you're looking out for that you maybe would want to look into a device like this. But one of the questions is, if someone didn't do this, or they weren't aware, or they didn't get their hands on a podcast like this and just had no awareness, what are some of the things that could come in adulthood if you don't get the
Oh,
palate
I
fixed
love
now?
this. This is so important. Yeah. So, talking about sleep disorder breathing being a spectrum, the starting is mouth breathing. The end of that spectrum is full blown obstructive sleep apnea, which means you stop breathing at least 5 times an hour as an adult. That's what the criteria is for what they would call stage 1 sleep apnea. So when that happens, it's also rare that it gets caught, because what's signaling a 25-year-old that has mild or stage 1 sleep apnea to go talk to somebody about it? They're used to the way they feel. If they're tired, they're busy. Maybe you've started a family. There's so much happening that you don't recognize your dysfunction necessarily, or you've slept that way, in my opinion, since you were 12, because you've underdeveloped jaws. So it's also your normal. And what we see downstream with obstructive sleep apnea is really serious. I mean, the cardiovascular implications are deadly: stroke risk, hypertension. I would say, outside of like, you're going to have a heart attack, which is like the scariest, and things I really don't talk to patients about much, because I just think anytime you're introducing fear like that, it clouds things. There have been patients that I have had to tell, you are a walking heart attack. I did a sleep study on an older gentleman that was overweight and a lot was going on, and he stopped breathing 82 times an hour. And that is like, you need to get a CPAP right away. We can help you. We can put you in a dental appliance. We can start working, but you need oxygen like today, And had that person had a tooth pillow when they were 5, like, they wouldn't be dealing with this. And so your overweight, obese patients as well is so much higher when they have sleep apnea. I like to talk about cortisol and insulin resistance and blood glucose dysregulation all the time, because I think it's such a hack to know your blood glucose. I don't know if you ever wore a CGM, but I'm all about it. I love it. I love to track that. Of course you have. Yeah. But these patients that have sleep apnea, especially women who come in and tell me like, I run, I'm healthy, I can't get rid of this belly fat, I'm immediately going, your cortisol levels are high. What's happening to your blood sugar while you're sleeping? Because if you have sleep apnea, your blood glucose will rise at night, and then your insulin goes up, and that because of the cortisol, and that creates belly fat. So I'm constantly bringing it back down to what's happening with our inflammation in our body at all times during the day, but especially during sleep. So you end up with, you gain a little bit of weight, and then more weight, especially the men. They don't know that they have sleep apnea. Now they're snoring more because their neck circumference is larger. And sleep apnea doesn't have a body type. I think it's really important to say that. We've caught severe sleep apnea on people as thin as you and me. It's very much the way their tongue fits in their jaws and all of that we're talking about on the prevention side with children. But once you start gaining weight because of it, it gets worse, and your apnea numbers gets worse because, especially if you sleep on your back, the weight of your belly pressure and all of that as your neck gets larger, the central obesity stuff starts happening, and your numbers get worse and worse. And it's really hard to lose weight when you have sleep apnea. Really hard. I don't know if you follow Dr. Matthew Walker or heard any of his stuff. He has a book that's called Why We Sleep. He is a Harvard neuroscientist and very famous guy now. So puts out lots of information, but I've heard him speak live twice. And he loves to tell people that exercise is futile if you have sleep apnea, because you're not recovering from your exercise the way you're supposed to if you're not in the proper sleep stages, which makes a ton of sense. You can't recover emotionally or physically from your day on poor sleep. We know that. They say 24 hours of no sleep is worse than drunk driving. So like the way your brain needs that rest, we should talk about Alzheimer's dementia later too, but the way your brain needs that rest in order to repair is critical. So if you can think of like any reason to put your child in it, if you don't have symptoms or whatever, it's in the hopes of preventing what is a major epidemic for adults right now in the world.
Yeah, those are some serious health implications as
Mm-hmm.
we grow into adulthood. And I think too, there's even just the aesthetic side of it, the receded jaw as you grow into an adult.
Absolutely. They
You
look
want,
beautiful.
yeah, you want that
Yeah.
that beautiful, strong jawline as you want to feel
Yeah.
confident in your body and in your appearance. And so yes, there's the health implications, but even for me, in and of itself, I was like the appearance of not having the receded jaw and supporting my children to feel really proud of, their
Oh my
face,
goodness.
how they
It's
show up
such a
physically in the
blessing.
world.
Absolutely. Absolutely. And to think that they can have the kind of straight teeth that I'm posting on social media and Toothpillow sharing from our patients, which people think are Photoshop, by the way. The amount of the world is
No
crazy and
way.
comes at me all the time. Oh, yeah. I mean, trust me. The dental community too. They're like, there's no
Wow.
way. And I'm like, you just never learned how to use this. And I can teach you. But it's like, that cosmetic aspect, and they didn't have to have braces. I had braces for years between the age of like 10 and 13. They put headgear on me the wrong direction. They wanted to pull permanent teeth. Thank God my parents said no. My parents are both dentists, which is why they said no, but they weren't orthodontists. So they just were like, no, we want her to have all her teeth. Thank goodness, because I can't imagine how much worse things would have been for me. But I still had to undo that orthodontic damage myself after, which is just not fair. Like you should get your teeth fixed when you're little and you should go on with your life, you know?
Yeah,
Like,
here, here.
like, come, what are we doing? So we've been doing it wrong for way too long. And when we decided to bring Toothpillow to the masses and create this company, I knew I would disrupt the narrative, and I wanted to because I had all the evidence to support the efficacy of these things, and they work every single time when they're worn. Every time.
And it seems like such a simple device. So tell me about Toothpillow. I mean, we've alluded to it, we're talking
Okay.
about it, but
Yes.
like tell me about
Okay.
the device itself and how, it's a little silicone device. It looks very simple, but it's extremely powerful.
Yes.
And tell us how it
It
works.
is. Yeah. And I think that's the reason there's so many dentists that are like, what are you doing? There's no way this works or whatever. Because one, they weren't taught about it in dental school. So I get it. I wasn't either. And I was actually, when I learned how to use these appliances, I learned from Dr. Ben Moralia, incredible airway doctor. He's one of the founders of Toothpill with me. And when I saw his cases, I don't know exactly how old he is. He's probably like 15 or 20 years older than me. He's been doing this a long time. I was at first very mad because I was like, I just spent all this money in dental school. you just showed me things that have changed the trajectory of these children's lives. And I have never heard of it before. I've never seen anything. And it should be the thing we're learning in our pediatric rotations. Like the single most important thing should not be even how to take a cavity out of that kid's tooth. It should be, are they having sleep disorder breathing? So as Toothpillow became a thing, what we realized is the masses needed to be reached, and the best way was to go straight to the parents because they weren't getting it from the dentist. And I'm one of those dentists, so I can say we are hard-headed, and it is really difficult to teach us anything once we get out because we are, we're really smart people. So you would think we would be more open to that, and we just aren't as a conglomerate. And luckily I am. I was raised that way. My parents always challenged every narrative. And so I think it was just like in my DNA. But what we built was Toothpillow is not a proprietary appliance. So if you go to our website, you can see pictures of appliances in kids' mouths and what they look like. I tell dads, especially, it looks like a football mouth guard to an untrained eye. Like, I don't have to get any more like specific. I do on podcasts. I'll get more specific on it, but for the dads especially, because they're just seeing the money and they want to know what on earth, like how could this be? But it looks like a football mouth guard. Toothpillow is the name of the company. So we're a virtual dental office in the sky, is what we like to say. So we built a company that could operate in every state by using a licensed dentist in that state to oversee the care. And we have an intake process that we alluded to earlier, where if you go to our website, you click, is my child a candidate? Free, just have your kid there because you got to take pictures of your kid as you're filling out the form. I want to know everything. I want you to fill this medical thing out. Like, I can't sit with you knee to knee in my chair. So you got to tell me everything I need to know so that I can make a really good decision on whether or not your child qualifies even for our virtual program. And then we take the photos that you submitted and we look at them and we decide based on age, symptoms, and severity if they qualify for virtual care. And I say if because there are hundreds of kids every single month that we have to unfortunately deny for virtual care, which is not something people really know. I would say the naysayers that don't know me or the company or what we built think that I'm just saying yes to everybody and here you go. Like it's a willy-nilly, and that couldn't be farther from the truth. We have sent thousands of children in office to appropriately trained airway dentists to make sure that they get the care that they need. They have teeth that are blocked out. They need expanders glued in. Like, the older you get, the higher the risk of that is. So Toothpillow monitors your care, the dentist and their assistant behind the scenes. And you're submitting photos to us. Like in the beginning, it's a lot. We do pictures a lot because we just need to get in that habit. We need the families to know that it's important for us to know that you're wearing it. And because if you're not, we need to figure out something else, because it is really that important that this gets done. And however it gets done, but it needs to get done, right? And so we monitor that care very closely over a 24-month period. You're filling out the questionnaires constantly, I would say quarterly, so we can start noting what symptoms are decreasing with time. It's really important. And the data we have is absolutely incredible. I can't even tell you. Toothpillow right now is it's the only airway dentist company in the world that I know of that's virtual. And we have screened more children than I think exists in a conglomerate of pediatric sleep questionnaires. And we're going to publish it. I'm very excited because we want to show the world what these appliances are capable of. And the reductions in percentages of bedwetting and tooth grinding and ADHD and mouth breathing, it's going to break the internet when it goes, because it's just like, finally, we can just tell the world, how many kids have been saved by this. So we pick the appliance. To get back to the appliance, we have a couple different brands we use. We use one supplier is Vivos, one supplier is MyoBrace. We also have a great relationship with a company called MyoMunchie. So for our patients that are going through myofunctional therapy with us virtually, they will also be having the MyoMunchie in their kit to be working on the chewing, because everything is around jaw development and muscle function. So we've got to be chewing harder foods and chewing on our MyoMunchie. Even as adults, for those listening, you can get a MyoMunchie online as an adult to work your jaw muscles. It's a really important part of your health and stuff as you age. So what appliance you get is based on your teeth. There are a couple of starters that everybody passes through, but which one you get is based on how many permanent teeth you have in your mouth. If you have all baby teeth, you're going to get our little bitty one, and you're going to start there like your 4.5-year-old. And those are great and easy to accommodate. And again, like the younger you start, the easier it is to get used to the bigger one. But if you start with the big one, it can be a little bit harder, like for your 7.5-year-old. But he or she, I forget, you have boys? Are they both boys?
All boys. All boys.
Oh boys. Oh, yeah. So he'll do fine. You just work with him and make it fun. And you know his personality best. I always tell moms, like, I had one kid of my three. I have 11, 7. I have 11, 9, and 7 right now. I have a daughter in the middle and two boys. And she was my hardest. She's a big part of my why, let me tell you, because she just was not as compliant as my boys were with the appliance. And it taught me a lot. She taught me a lot. So she's had a lot in her life because her mom's an airway dentist. And I'm like, honey, no matter what, you're going to have big jaws. So I'm either gluing something in or you can wear your tooth pillow. You know? So she's a podcast for another day, but things are going really well there. But I think it's important for people to understand that the appliances are picked based on the patient, based on what teeth they have. And then as they get older, there is a final appliance that has tooth grooves in it. That's where some of this cosmetic stuff just blows people's minds. And it really looks like we put braces on them. And we have a way to size based on these 4 front teeth. So once your child's 4 front teeth grow in, we've digitally sized them and we can pick out the appliance and send it to you. So we have a proprietary measuring tool that is like we couldn't work without it. So
How does the appliance actually work to develop the jaw, though?
yeah, so the starter appliance, the one you're talking about that your kids have right now, it is taller and bulkier. Like not, it is kind of bulky, but the part that the teeth fit into, we call it the phalanges, go up under the lip here and here, and it blocks mouth breathing. So there's 2 main takeaways that without getting too granular, 2 main takeaways I want everybody to understand about these appliances, the starter appliances. They do 2 things. They redirect breathing through the nose, which means your tongue is up, and they redirect musculature, meaning the lips are off the teeth. So your lips and your tongue literally determine the position of your teeth. People don't realize that. The muscle pressure moves teeth very easily. Teeth can be moved when instigated anytime they want. So your muscle function needs to be really good. Otherwise, your teeth will shift and change as you age. So when they put the tooth pillow in, their tongue goes up and they're breathing through their nose. And all the pressure of the lips and the tongue are off the teeth, which allows them to go into the position that they need to. So that's really the 2 takeaways that I care about that people understand. You know, they'll say, oh, it's not an expander. People love to come at me in the comments about, don't call this an expander. I say, I'm not calling it an expander because it's not an expander. But the amount of expansion we get from this thing is wild because the tongue does it like it's supposed to, you know? So
Got it. And so when would a child need an expander versus just the appliance?
severe, yeah,
You said that there's some kids that you don't approve right away
Yeah.
either.
absolutely. Yeah, severe crowding. I mean, you should see, we're screening over 1,000 kids a month right now.
Mhm.
And so I would say majority of them are getting approved when they're under like 8 years old, but the 8 to 12, I think our denial rate's above 50% because they will have teeth just everywhere. And we know, so we need to understand the growth curve. So at age 2, your child's head and neck development is 55% complete. At 2. By the time they get to 12, it's 95% complete. 95. So if you're submitting between the ages of 9 and 12, I know that I have this window of getting that skeletal expansion completed before you end up a 15, 16-year-old and older. And now you need adult expansion, which is a lot more invasive and a lot more expensive. So when we're looking at that window between 9 and 12, if I know, because I've done thousands of cases, that the tooth pillow alone is not going to make enough room for all your teeth because of where you are in your growth curve, it's the right thing to do is to send you an office for expanders. That's the right thing to do. And that's what takes our expertise. And having done so many cases, we can look at a child's teeth and know, yep, if they wear it, this tooth pillow is going to do what it needs to do, or it's not. And that's the conversation we have to have with the families. And that's hard because sometimes they are hours and hours away from somebody who's qualified. But the right thing to do is to get them in the right hands.
So they do the expander, and then after the expander is done, get into a tooth pillow for the lower jaw, since the expander is not going to do the lower jaw as well.
So we do upper and lower.
Got it. Okay.
But yes, so my practices around Texas, we do upper and lower expanders with a tooth pillow. So when I teach dentists how to do this in their practices, I'm combining the therapies, which is really great. And so we're doing that behind the scenes now, tooth pillow too. We have our expanders also program where we technically know they need expanders, but we want them to be wearing a tooth pillow at the same time. And so we can go ahead and help with that part of it. but then they still need to get expanders in order to have the result that we know that they need. So we're figuring out a way to help these families get something always. Like our denials don't mean you don't need treatment. Our denials just mean that it's so severe you need to be able to get in with somebody and have a custom expander put in. And so that's kind of a little bit different between like the virtual only versus our expanders also program that we're launching too, which is important distinction. But again, it's really hard when they have to travel like hours.
But it's incredible that you're able to do such customized support for these children in a virtual practice, which the virtual practice is also what makes the cost nearly half of what you're doing in office.
Yes, absolutely.
Which
right. Yeah. It's this important part of it, because the fact of the matter is access to care matters and it's really difficult. And then getting the right opinion really matters, because there's a lot of people touting themselves as airway orthos and they're not. It's unfortunate. But then also the cost aspect of it too. If you've got 3 or 4 kids that all need phase 1 at one time, then a virtual platform like this makes a lot of sense. And again, the earlier you submit, the better, because if we have to deny, most of your kids or half of your kids, then you got a lot more expense coming in for custom expanders at the same time that you're also doing your virtual care with your younger ones. So I always tell moms, like, if you really can't do all the kids at once, if you can't start treatment on 4 kids all at one time, because it's a car, like I get it, you need to choose the oldest one. And it's like age and then symptoms is what I tell them. Like, if you got one that has obstructive sleep apnea and their oxygen levels are going to affect their brain right now forever, then obviously that child probably should trump. But the older they are, the harder it is to get these things done in a cost-effective way.
So the very first place to start for everybody listening is with the free assessment. I'm going to link that in the show notes, and I'm also going to put my code Carly Brown, and that gives them a free video review from one of the dentists.
Oh, wonderful. The team. Oh, that's wonderful. Oh my gosh, good. They'll love that.
Yeah, and so the final thing I wanted to ask you is, you just had mentioned Alzheimer's earlier. I wanted to loop around to that because that was. Tell me a little bit about where that.
I'm so passionate about this because I think if you've had a family member that has gone through dementia or Alzheimer's, it's the most heartbreaking thing on the rest of the family. Truly, it's horrific. And my dad's grandmother suffered from that, and it's still traumatic for him to this day to remember, because they were really, really close. And so when I started researching and learning more about obstructive sleep apnea in the adult realm, the sleep architecture and Alzheimer's dementia stuff came into play. And I was just, at that moment, I was like, every single adult patient that walks in my door will have a sleep study every single time. Because what happens is with Alzheimer's, if you're familiar with it, you understand that the brain builds up toxic plaques. They're called beta amyloid plaques. And I always wonder, well, why does that accumulate? And there's talk on sugar, like type 3 diabetes. They're talking about sugar going in through the brain, through the blood-brain barrier, and creating this beta amyloid plaque. But your lymphatic system, so the brain's lymphatic system, is designed to remove those plaques. Well, guess what doesn't happen if you don't get any deep sleep? That glial cell, so the brain cells look like starfish, and they're really wide. Like right now, you and I are talking, so ours are wide and active, and all this information is transmitting. When you go to bed and you fall asleep, and you go into the deep sleep stage, those glial cells shrink, which allows blood flow in the lymphatic system to wash out through the brain. When you have obstructive sleep apnea, their deep sleep is often minimal to none, which means that their staging and their glial cells are active the entire night, and they're in this light sleep, REM, wake up sort of chaos the entire night. And that's how those beta amyloid plaques continue to rise and don't get flushed out. And so I'm like, at that point, every single patient that is suffering from Alzheimer's dementia needs a sleep study. They probably need to be on a CPAP immediately. Like, get them some oxygen. Let's get that deep sleep up so that their brain and their lymph system can decrease those plaques. It's wild. So I'm so passionate about that, because if it is this simple, like, this is where we need to be focusing our time and attention for our adult patients.
That's fascinating. I got an email yesterday about Toothpillow for adults, which would play into this conversation. So that's literally all I know, is that it's coming. That's the most I know.
Yeah, we've been telling people it's coming. Yeah, we've been telling people it's coming forever because anything that we're going to be doing with adults, and we have some people in our clear line of beta trials right now, which is really exciting. But anything you do with adults passes through an office. And because we have to take custom molds, like we're all growing. So people keep saying, is it going to be a tooth pillow for adults? I'm like, I wish that we could just give you this and then you would be good. But we are building that. And if anybody wants to be on the forefront of knowing when that's launching and how they can get involved, you just have to put your email address into our teens and adult tab. So if you go to Toothpillow at the top, the kids stuff is obviously live and active. We've been doing that for years, but at least you'll get updates as we get ready. We're betaing it in small states right now, but we are so excited about this. It's a very important part of again, access to the care and understanding and being able to get a sleep study and know what's going on with your health. So we're very, very excited, but I don't have a date for anybody that I can tell you right now. But if you put your email address in, trust me, I mean, I don't know, we might be above 3,000 emails right now in our portal of adults that are waiting for information. So just put your email in there and we'll let you know.
I love it. And correct me if I'm wrong, but the age range currently for Toothpillow is 3 to 12?
It's 3 to 12. So if you are between the ages of 3 and 12, you can submit your child for an assessment. And yeah, again, the older they are, the conversation changes just a little bit. Hopefully they get approved, but if not, you will be connected with somebody on our team to help you find a dentist. We're not just like, oh, sorry, here you go. It's like we really want to stress the need for that child to be in office. And yeah, we'll help from there.
Yeah, and for the mamas or the moms, the dads of the parents of littles, where you would think like, oh, 3, 4 years old, like, do they really need to
Do
get
it.
started? I am a testament. Getting my son on it or 4 years old has been so much easier than waiting until they're older. So yes, 3 years old, my 10-month-old will be in one as soon as he possibly can. And
Good.
as we wrap up, my question for you is, the audience that is listening to the Here for Healing podcast really cares a lot about their family's health, about holistic health, about prevention, about living a radiant, vibrant, long, healthy life. Is
Yes.
there
Oh.
anything that you would want to share to leave them with? Maybe anything that I might have missed, didn't ask, just in regards to this topic?
I think the most important thing is prevention of any form of disease that we can. We talked about biologic dentistry and the root canal connection and all of that. And I think at the end of the day, your sleep needs to be really, really good in order for your body to heal in every aspect. And if you are struggling, if you're waking up at night, if you're getting up to go to the bathroom, if you're tossing and turning, something's going on. And don't just assume it's stress or where you are in life right now, or, oh, I'm premenopausal, so this is meant to happen. Don't assume that because there's so much that we can catch and treat to help. And on the pediatric side, I firmly believe that the decision that these moms are having to make right now on who does their children's orthodontics is the single most important decision we will make as a parent because of the way it affects them for the rest of their life. So I would strongly consider a second opinion. If you don't do an assessment on Toothpillow for whatever reason, and you're about to go in and do some expander with somebody, please get a second opinion with us. Let us look at the case because we are experts in this area, in this arena. And once you do it, you've done it. And I just want to make sure it's done right the first time for our kids from here on out.
Amazing. Dr. Hale, thank you so much for your time and your expertise today. I know this is going to serve and support so many people. Thank you so much.
Oh, well, thank you for having me. We'll have to do it again one day.